Mr. Tan had been admitted 2 days ago for an orthopedic procedure. He looked like any other ward patient, resting quietly behind a curtain. He had one thing in common with many patients. No one had asked about alcohol use on admission. On the first afternoon, the nurse noticed that he was not quite settled. He kept shifting in bed, rubbing his hands against the blanket, and reaching for his water cup with a slight tremor. "Nurse," he said, "I feel a bit shaky. I just cannot seem to relax." The nurse checked his pulse and blood pressure. His heart rate was mildly raised, his blood pressure a little higher than before, and his hands trembled when he stretched them out. "When did you last drink alcohol, Mr. Tan?" she asked. "2 nights ago before I came in," he answered. The findings were subtle, but they followed a pattern. 6 to 12 hours after the last drink, alcohol withdrawal can begin with tremor, anxiety, sweating, nausea, insomnia, and mild tachycardia or hypertension. The nurse stayed at the bedside and started a structured CIWA-Ar assessment instead of relying on impression alone. She documented the score, checked his observations again, and kept the environment calm and well lit. A little later, Mr. Tan became more unsettled. He sat up quickly and stared towards the far corner of the room. "Did you see that?" he asked. "Something moved over there." The nurse looked where he pointed, then back at him. "There is no one there, Mr. Tan. It is just us." He still knew who he was and where he was once reassured, but he remained frightened and distracted. This fit withdrawal hallucinosis, which can occur around 12 to 24 hours after the last drink. Hallucinations may be visual, auditory, or tactile, and the patient may remain otherwise oriented. His tremor worsened. He was sweating more, his heart rate climbed, and his CIWA-Ar score rose. The nurse updated the chart, pressed the call bell, and spoke firmly to the senior nurse. "Mr. Tan in bed 4 is showing alcohol withdrawal," she said. "He has tremor, hallucinations, and his blood pressure is trending up. His CIWA score is climbing." The senior nurse arrived, and the team prepared to escalate care. A rising CIWA-Ar score was no longer a small matter. It was a signal to act early. Within a short time, Mr. Tan changed again. He became profusely diaphoretic and more confused. He no longer answered clearly and kept asking where he was and what time it was. "Where am I now?" he muttered. "What is happening?" The nurse checked his temperature and pulse and reported the rapid change. His heart rate was now very fast, and his orientation had deteriorated in minutes. Suddenly he stiffened and had a generalized seizure. The nurse moved quickly. She protected his head, cleared the area, called for immediate medical help, and did not restrain his limbs. She watched his breathing and stayed with him until the team arrived. Seizures usually occur 24 to 48 hours after the last drink. They require urgent review and airway protection, with safety as the first priority. After the event, the doctor ordered symptom-triggered treatment and close reassessment. The nurse continued frequent monitoring, documented the findings, and kept the environment quiet, safe, and easy to orient him to. He settled afterwards with a regular dose of lorazepam. Brought to you by TTSH Psychiatry, July 2026.